All right. And I have the pleasure to introduce our next speaker, Saima Hasnin. Dr. Saima Hasnin's research and extension work involves taking interdisciplinary and collaborative roles to assist low-resourced children and providers in overcoming barriers and providing high-quality nutrition, care, and education for preschool children from low-income families residing in rural areas. Currently, she is an assistant professor in community nutrition in the Department of Food Science and Human Nutrition at the University of Illinois Urbana-Champaign. Dr. Hasnin recently obtained her PhD from the University of Nebraska-Lincoln this year in August. Her dissertation work included determining evidence for criterion-related validity of the Veggie meter as an alternative method to assess preschool children's fruit and vegetable intake. Today, she will be presenting the findings from her systematic review that was previously posted in the chat, and I'll go ahead and repost that, and meta-analysis as a part of her dissertation work. Dr. Hasnin, welcome.
I'm going to go ahead and share my screen first. Can you all see my large screens for the presentation? Okay, cool. Well, thanks so much for that introduction. And, this is my first time for the Winter Veggie Meter Forum. And thank you so much for inviting me to talk about my presentation. So without further ado, I will move on to the presentation and jump in. So I assume that the folks here would already know about what is reflection spectroscopy and advantages and uses. And we kind of already know that skin carotenoid is a valid biomarker for fruits and vegetable consumption. So given the convenience of using a Veggie meter to assess skin carotenoid score, as community health researchers and program evaluators, we all are interested to utilize this device conveniently to assess fruits and vegetable consumption. And since young children who are not capable of self-reporting their diet, so there is a specific interest, and Veggie meter comes more handy for assessing these children's intake for fruits and vegetables. So then the question arises is whether the children's skin carotenoid score that is being assessed with the reflection spectroscopy, that is the Veggie meter, is representing their fruits and vegetable consumption and or not, like how much of it is accurately representing. So which we can refer to as criteria-related validation of reflection spectroscopy for children's fruits and vegetable consumption. And so today, my goal was to kind of present review results that we have done before. And I'm going to talk about all the methods that I used for the systematic review and the meta-analysis, and then go from there for kind of discussing a little bit of the implications of the findings. Okay. So first, I would like to show you the collaborative team I was a part of when I was doing this work when in my grad school. And you can see that this team comprised of the faculty and grad students from 6 different US institutions in 6 different US states, and very, very fortunate to be a part of this team. It was wonderful working with them. And really excited because Dr. Virginia and Dr. Susan is in here today. So it's great to have them. Okay. So before jumping into the methods, why did we do this systematic review? Because there was another systematic review that was conducted in 2020. And this review particularly included research articles published until December 2018, and reported all the criteria-related validity of spectroscopy-based skin carotenoid measurements as a proxy measure for fruit and vegetable intake. And the first author is also in here in this forum, so excited. So the reviewed articles used spectrophotometer, reviewed the spectrophotometer, resonance Raman spectroscopy, and also reflection spectroscopy, and that were being used in the research to assess skin Cartman score. And since it included articles until 2018, there was like no evidence that was showing criteria validation of reflection spectroscopy for children, but there were 2 articles for adults. And there were not much article published before 2018 for the children. So that kind of encouraged us to move forward with conducting a systematic review in 2022. And for this particular systematic review, there were 4 aims, but for today's presentation, I just shortened and only presenting results from 3 aims. And these included to identify non-dietary correlates for children's reflection spectroscopy-based skin carotenoid score, and then also kind of summarizing the existing evidence we have for the validation and reliability studies for reflection spectroscopy, if we have any. And third, we also wanted to conduct a meta-analysis to determine the criteria related validity, the correlation size for the reflection spectroscopy and its association with children's fruits and vegetable consumption. Okay, so this is the flowchart for my method, so bear with me. So first we kind of registered the systematic review methods in Prospero. And at the time, the Prospero was only kind of focusing on the COVID-related articles. So they kind of said that we cannot review, but they gave us the registration number for that. And there were 8 search databases included, and an experienced librarian who is also a co-author for this article. She conducted the search, and then the search string is added in the appendix for the published article. So if you kind of download and go below, then you can find it, the search string. And it is a best practice to kind of publish your search string, because so that other people can reuse and find out what are the relevant keywords we used, and then replicate actually the results. And then we used Zotero for managing the references, and we used DistillRSR for screening the title and abstract. All abstracts were double coded by 2 authors, and 25% of the abstracts were blindly coded by another co-author. So eventually we ended up with 11 articles, and that you can see in here, 11 articles. And then we use the Prisma figure for reporting. And for risk and bias assessment, we use both NHLBI study quality assessment questionnaire and also the STROBE for cross-sectional studies. So the cross-sectional studies were basically double-coded for risk and bias with both STROBE and NHLBI. And then finally, we conducted meta-analysis for 4 studies to determine the effect size, the correlation size between the reflection spectroscopy-based skin carotenoid score and children's fruits and vegetable consumption. So these are the inclusion and exclusion criteria. And I would like you to know that we included any studies that kind of included 2 to 10-year-old children, and even if it was mixed with adult participants. And for meta-analysis, we included 1 more criteria that the study had to report correlation between the fruits and vegetable consumption and skin carotenoid score. And so we, as I have mentioned in the methods, flowchart, we had 11 articles for the full text review. And in these reviewed 11 articles, there were 9 individual research projects. And the pink ones are the intervention studies, and the gray colored tiles, those are showing the cross-sectional design study. So we had 8 studies that were cross-sectional. And then you can also see the study locations in here. Most of them were conducted in the USA, and Zhang et al. Was kind of like a multinational study being conducted in Korea and Germany, and 1 other study was in Japan. And mostly you can see that it were like published in around 2018 to 2021. Oh, another fun, interesting information in here. So Zhang et al. Has used a different type of reflection spectroscopy-based device, kind of like a prototype that is different from Veggiemeter, and the rest of the studies have used the Veggiemeter as their reflection spectroscopy-based device. So that was fun, kind of different, knowing about a different device other than Veggiemeter that also has the reflection spectroscopy-based methods. So that, and then let me help you understand these numbers and this slide. So on the left-hand side, the age range, what I wanted to mean is 3 studies had children who were 5 to below 5-year-olds as the participants, and then 2 studies had 5 to 8 age range of children, and then 6 studies had 9 to 11 years old children. And for the race and ethnicity, what I try to convey the information is that 3 studies had 77 to 86% of the children who were Black, and then 2 studies had high percentages of white children, so 68 to 80%, and there were one study which had 100% of Latino, population or children, and then one study had Asian, that is like Japanese children. That the study was conducted in Japan. And then the weight status, kind of the range for overweight and obesity was from 20% to 57%. These time points are very interesting to me, and there were 6 studies who were collecting the data, using 3 time points, and the gap between time 1 to time 2 and then time 2 to time 3 were kind of averaged 16 days to 4 months. So that is an interesting point for conversation. What should be done for population level or community sites, research studies, that what should be the accepted range for this time 1 to time 2 gaps. And for settings of data collection, there were childcare settings and the school settings, then community settings or church, and one study was conducted in laboratory settings. And so this is the study characteristics, and as I have mentioned, eight studies were cross-sectional and 3 were in interventions. So for the cross-sectional studies, what they were kind of like, their research aims were identifying the group differences for skin tightness score across different age groups or ethnicity, across different sex and weight status. And then also one study wanted to do refine the data collection procedure for reflection spectroscopy-based skin tightness score data collection in school. And then also kind of explore and analyze the correlates of reflection spectroscopy-based skin tightness score for children. And the intervention study, all 3 intervention study was evaluating nutrition education intervention that was aiming to improve children's fruits and vegetable consumption. These are the results for the risk and bias assessments, and out of 8, 2 cross-sectional studies had high risk of bias, one had moderate, and 4 had low risk of bias. And for the 3 intervention studies, 1 had high risk of bias, considering that it didn't have a control group. And these are the 2 tools I have used for coding my studies for risk of bias. So these are the non-dietary correlates. And on your left-hand side, these are the positive correlates. So how we are gonna read the slide is like physical activities or exercises that are positively correlated to children's skin tightness score. And this was reported only in 1 study, and 1 study has found significant. And income was considered as a correlate in 3 studies, and out of 3, 1 study has found reported it as a significant correlate. And same goes for age. Out of 4 studies, 2 studies have reported age as a significant positive correlate. For male, I have put an asterisk in there and to remind me that for like gender or sex, nationality has worked as a confounder or a interaction